Once we have a good understanding of the diagnostic formulation, we can now implement a strategic management plan. What they do in the MEQ is ask you to focus on specific domains of these management plan. But in your clinical practice, or if you had to implement a management plan, in the long case, for example, this is what you think about. You always think about risk and setting first. Once you start off with risk and setting, the next bit is clarification of diagnosis or information gathering. So think about it this way. I need to ensure what the risk is at this point in time and provide the adequate framework to proceed with my information gathering, because there's no point sending the patient home and then it ending with a disastrous consequence because I didn't create the right framework. So risk management and setting is the most crucial aspect of your management plan. The next domain is clarification of diagnosis and information gathering. And we'll see what we do there specifically. Then after that, you go through treatment of symptoms. And you can think about what are the key elements to address, and of course think about biopsychosocial cultural strategies. And then finally, you enter the phase of long-term treatment. So this is what it looks like. Risk management and setting, clarification of diagnosis, treatment of symptoms, and then long-term treatment. Long-term treatment is divided into relapse prevention, drug and alcohol relapse prevention, and psychosocial rehabilitation. Then you think about the barriers to implementation, because you might come up with the best management plan, but there are barriers to you implementing it. Patient doesn't want it, family doesn't want it, you don't have the framework, you don't have the service, you work in a rural area, etc. So that becomes a separate domain that you highlight as barriers to implementation of the management plan. And finally, you think about prognosis. Prognosis is usually divided into short-term and long-term. Short-term prognosis, by which I mean response to treatment. Long-term prognosis, by which I mean the propensity for relapse. So when you define these two terms, you're able to state what you think about the prognostic aspects of this particular patient.